Well, there it is, everybody. It's 9:30 a.m. on Thursday, the 10th of November, and it's an absolute thrill to be chatting to all of you here today for our national conference of the Institute of Health and Social Care Management. Those of you who have not had the privilege of seeing before, my name is John Wilks, and I do have the absolute privilege of being the chief executive of this fine organisation. I have to say, today in the programme, we are joined by an absolute galaxy of totally brilliant people who are giving up their time to come and talk to you and explain to you their stories, tell you their experiences, and give you hopefully some inspiration and motivation to see you through the coming winter months and then out into the spring, when I'm delighted to say we will be having a physical national conference at the end of April at the Excel Centre in London as part of the Health Plus Care Show. Today, there's only one rule, if you don't mind, which was we'd be very grateful if you'd leave yourself on mute while the presentations are taking place. We will encourage you to unmute and ask questions when we get to Q&A sessions. But beyond that, do what you like. You can record it. You can watch this in your underpants if you like, with your camera off, That's entirely up to you. You know, your business, not ours. But we do hope that you enjoy today. I am delighted to be joined today by Jade Maloney, our queen of virtual conferencing. Jade is our operations manager at the Institute and will make everything happen behind the scenes. And I'm also thrilled to see Adam Purnell on screen. Adam is our Director of Social Care at the Institute. For those of you who don't know, we did change the name of the Institute to include social care a couple of years ago, and we are thrilled that we did. It's been very empowering and liberating and inclusive for all of our wonderful colleagues in social care. Beyond that, I'm not going to say anything further. You'll get the gist of the day as we go along. I've got to say, bit of a lump in the throat, because we've got the most fantastic start to the conference today. We have the one and only Anne Marr, OBE, Chief Executive of St Helens and Knowsley NHS Trust, who, Anne, I'm delighted to say, you know, you were HSJ winners of Trust of the Year, I think a couple of years ago. And we all, well, I know how you managed to do that, but you're really going to tell your story about what took place from the moment that you were appointed in 2003 up to the present day, and really your secrets of how you lead such a fantastic group of people up there. For those of you that don't know, St Helens and Knowsley is our regional hub for the Institute for the northwest of England, and we just can't think of anybody better, basically, to come along and open up our conference today. So, Anne, I'm going to hand straight over to you. Thank you very much indeed for doing this. We're really, really grateful. And Anne Marr, everybody, over to you.
Thank you. Thank you very much, John. That was a wonderful introduction, and I hope I can live up to the expectations you've just created with that great introduction. So thank you and good morning, everyone. So this is my leadership journey. Next slide, please. So Trust, of which I am the chief executive, is much like many, 350,000 population, 827 beds, 540 million turnover, knocking on 7,000 staff. So it's very typical of a DGH. We serve the boroughs of St Helens, Knowsley and Halton, and the south proportion of Liverpool as well. We've got extremely high levels of deprivation in our catchment. That all of our boroughs are in the top decile in terms of deprivation, and we actually have the privilege of serving 2 out of the top 3 most deprived boroughs in the whole of the country. So very busy emergency take. Now, in normal times, this will be, so average time, long before the pandemic, that would be 94% of all our bed days were used by non-elective patients as opposed to elective patients, so very heavily weighted towards non-elective activity. And as you would imagine, that means that now it's like 103% of our bed days are used by non-elective patients. So, obviously with the advent of the situation we're in now, we barely have any space to put elective patients. We do have a cold site there, that helps. And we've also got a very expensive PFI estate that we have to find a way to pay for as well. So if I was to summarise that, therefore, we are a suburban DGH in a community with very high levels of deprivation and therefore morbidity, And we're overwhelmed with levels of emergency activity, even at the best of times. And we're also saddled with a huge debt. So that kind of sets the scene for, many excuses of why we might not be able to just perform as we might want to. But I'd like to give you an alternative view. So, as opposed to what might be expected of an organisation in that position, we have been rated the best place to work in the NHS on numerous NHS staff surveys over the years. We've got the scores for the last time we ever did a place inspection was 2019, and for the 3 consecutive years we got the best patient environment scores in the whole of the NHS 3 years running. And as you know, that includes not just things like cleanliness and privacy and dignity, but also the provisions you've got in place for things like caring for dementia patients, etc., and the disabled. So, lots of different things being scored there. We've also won, the MJ Award in conjunction with our partners, St Helens Council, and previously the CCG. And obviously that work continues in the new place arrangements. In the days before the pandemic, we achieved all of our targets except A&E. We weren't achieving A&E even before the pandemic, let alone now. And we're always in financial balance and remain so, and with reference costs of 94. So despite having that huge PFI cost burden, we still managed to keep our reference costs below the 100. I mentioned we were the IHSCM Trust of the Year in 2019 and rated outstanding. And it's really hard, anyone who's been subjected to CQC inspection, how hard it is as a DGH to get to be rated outstanding, because one of the things that tends to track the CQC is when you're doing something nobody else is doing in terms of some complex procedure or whatever. And when you're a DGH, that's not really the sort of patient group that you're dealing with. We're just doing undifferentiated emergency patients turning up in their droves and standard elective activity. It was really hard to persuade the CQC that that's outstanding, but we managed to do that and maintain our outstanding rating to this day. When I first came here, these were the pictures of the 2 hospital sites that our trust consists of. We have a 3rd site which has 1 intermediate care ward. I have to keep saying that because if I don't mention them, they get upset. So our 3rd site is, we don't run the whole site, we just run the inpatient part of it. So these were our sites that we actually owned at the time. And as you can see, they were not the best physical condition. One had been a workhouse, one had been someone's house in the past. And at the time, there was an absolute crisis going on in terms of, it was TRI in those days, remember that? TRI inspectors. And these were the regulators that were slamming the hospitals. And it was pretty disconcerting when I got the job to see a headline saying new boss at failing trust. It was a bit off-putting when you've just accepted a job and then you get a headline like that in the paper. So that was the kind of scene of when I first came here. So just in terms of how did I get to that place? So I'm one of these people who started their career as a band 3 and as a band 3 clerk in the accounts department at what was then the regional health authority. So I've come right up through all of the ranks of the NHS. So having started off in finance, I spent 10 years as a finance director in 2 different trusts, and then decided to try out being a chief executive by going to be CEO of a small specialist trust. Decided, that was for me. So I took this job. I started the job on the 1st of January 2003. And this is what I found when I got here. So on the back of those headlines in the paper, demoralised staff, really inadequate performance, poor quality ratings, finances were massively in the red, crumbling estate, not fit for purpose, built, the main site built as a workhouse with all of the characteristics that brought with it. Very dissatisfied community, much criticism from the councils and the MPs and indeed the population. There was no executive team at all. I just had a medical director and no one else. And just an absolutely huge amount of things to fix as I embarked on my career with this organisation. So the plan So the plan was set some standards, get myself a leadership team to join me, improve quality and patient satisfaction, encourage and inspire staff, improve the performance against all the key metrics, implement some financial discipline, balance the books, replace the estate with buildings that were designed to be 21st century hospitals and not to be workhouses, and to develop much more positive relationships with our population. And so, you know, they're all obvious, but it's when you make a list of, okay, that's what needs to be done. Easy to write a quick list, quite hard to do, but that was the plan. That was what I decided I needed to do to begin to get to where we needed to be. Next slide, please. Oh, so yeah, sorry, this me flashing in bit. Yeah, so obviously at the end of all of that, you know, I did have that little thing about maybe one day we could be the best hospital in the whole country. That was something I did secretly, probably didn't say it out loud, but did secretly aspire to. And if you press it again, a little smiley face will come in. Yeah. Okay. So next slide. So the first thing obviously is to have a vision and share the vision. So it's like, how'd you come up with a vision? Well, it's just like it kind of needs to be what it is on the tin, doesn't it? So, you know, what did I want for this population, of which I'm a part, because I actually do live in catchment and always have. So it was like I was born here and everything, you know, so my home trust as well, just adding to the desire to make it the best. So I wanted to provide the best possible quality of clinical care, yeah, obviously, in a clean and well-maintained environment, you know, obviously. Patients being treated with dignity and respect by staff who feel valued and value each other, and all delivered within a culture that promotes learning, prioritises safety, and always puts patients first. So that was just saying out loud what, you know, I guess we'd all say we wanted from our healthcare provider, but it's good to articulate it. And that was the vision that I articulated for the organisation. So back there then in 2003, which probably not so many of you remember, but I certainly do. So the rating system in those days is you could go from 0 to 3 stars, and it was, yeah, as ever, you know, based on a whole range of quality and performance metrics. And my ambition was to achieve 3 stars as quickly as possible from a start point of 0 stars. So with got the new team in place, set out a clear plan, created new systems and structures, engaged and inspired the staff, wired up the levers, because you do need the levers to be wired up to make things happen. And we achieved 3 stars by 2005, and it was kind of April that the stars came out. So from January 2003 with none to April 2005 with 3 stars. So meanwhile, while all that was going on, we developed a business case for the complete redevelopment of the entire estate, every stick of the entire estate. Secured £400 million in PFI capital, which in those days would buy you a hot site and a cold site as well. We conducted a huge programme of service and physical redesign plans to get the right things in the right places. Tendered the contract, and we were ready to sign it in May 2006. And the exec said to me, what on earth are we going to do now? Because you can imagine we've been running at a fast pace to get all that done in that amount of time. What are we going to do now? Next slide, please. And I said, we're going to start delivering 5-star patient care. And the exec said, don't you know you can only get 3 stars? So I said, let's go beyond ticking the boxes, because ticking the boxes, you know, achieving 3 stars, it's achieved the tick of the boxes phase. But let's aspire to do better than just ticking the boxes. And let's deliver care that's best practice, high quality, and provides an excellent patient experience. Let's have communication that's courteous, timely, and inclusive. Let's have systems that are efficient, patient-centered, and reliable, so that people get what they're supposed to get when they're supposed to get it. It's reliable. Let's have pathways that are planned and embedded, but also personalised to the individual. And let's deliver all of that in an environment that's safe, high standards, good outcomes, and a learning culture. So that's all very wordy. So we needed to turn that into something more manageable to communicate that to our staff. And this is what we came up with, the STAR chart. And the STAR chart was invented in 2005, and the STAR chart remains on every wall of every room in the organisation until this day. And so what we did is just summarised all of those things I've just said into something that's really quite simple to look at. Best practice, high quality, excellent experience for care, courteous, timely, inclusive comms, efficient, patient-centred, reliable systems, planned, personal, embedded pathways, and good outcomes, high standards of learning culture, which gives us a safe environment. And that was our 5-star care. So the whole trick to this, and you know, if you ask me like what's the most important thing in all this in a way, is that these things have to be actions and not just words. Everybody's got things plastered on walls with actions, with words on, but you know, you have to make sure the actions match the words. So our star chart forms the basis for the corporate objectives every year. Each star heading is a series of actions agreed, which is the whole point of taking us closer to achieving the vision. You can't just have it there and we're not doing anything about it. So corporate objectives then become the executive director's personal objectives. Everyone in the trust works for one of the executive directors, so those objectives are cascaded throughout the organisation, all work towards the same goal. We have a start of the year conference every year where we inform everybody what these goals are and what we're trying to achieve, so everybody knows. Obviously, we have to add in objectives about performance and finance and things like that we also have to deliver on. And we have the same consistent messages year on year. So just keep pressing the button and you'll see that every year the same slides. They did start 2005, but I can't find them going back that far. But each year we have the same thing, same kind of format. Carry on, keep pressing till we get to 22, 23. So as you can see from that, you know, every year, so for each of the star chart headings, we have a series of objectives so that everyone, they're on everyone's wall in the whole organisation. So everyone can see exactly what we're trying to achieve. Obviously, the report that goes to the board is more complicated, this with dates and times and people who are responsible, but this is the thing we put on every wall in the organisation so that everybody knows what we're trying to achieve and therefore can play their part in delivering on it. And it means that our, you know, our vision through the star chart isn't just something that's on a wall. It absolutely is the absolute core of the corporate objectives every year and has been since 2005 when we first conceived it. And that consistency, I think, is important. So we also make sure people, and again, trust again, we also ensure people all understand that everybody has a role to play in delivering 5-star care. So this was an event we ran where everybody had to write down, you know, how do I deliver 5-star care? And we've got, you know, a whole range of different people on the photograph, obviously many more participated, but, you know, we've got porters, phlebotomists, you know, catering assistants, consultants, everybody saying what they do in their role, in the many roles that we have in an NHS organisation to deliver 5-star care. It's everyone's job. And that was me saying what I did. So I provide 5-star care by ensuring that every decision the trust makes advances our 5-star vision and upholds our values. So that's just a kind of demonstration that we do really mean all of this. So obviously, well, a lot of what I'm talking about is about creating the right culture. And, you know, a very kind of simple description of culture is, you know, what goals we set, what standards we expect, what is celebrated and recognised in the organisation, and the sum of our values, traditions, beliefs, interactions, behaviours and attitudes. That's what creates the culture. And one of the things that I've put quite a lot of store by is ensuring that the most senior clinical people are engaged with that culture. And the reason why that's important is because they're the people who set those standards at the front line. They're the most senior people delivering at the front line. So every time somebody applies for a job as a consultant in this organisation, because they're the most senior people at the front line, I ask them, will you agree to be a role model for the trust's vision and values and uphold the trust behavioural standards by showing kindness, respect to patients and colleagues? And this is at the pre-interview chat stage. And if you're not, maybe you'd be better going working somewhere else, because there'll be lots of places out there that'd be very happy with you. I won't be, because that's what we expect you to do in this organisation. We don't do prima ballerinas and egos. So if that's what you want, don't come here. Now, that's a kind of risky thing to do when you've got a workforce crisis going on. But actually, what happens is you start to recruit people who like that, who want to be part of that. So, you know, trainees coming off the scheme and they've worked everywhere, and a number of people, when I have these conversations, they go, oh, on the contrary, that's why I've applied for a job here, because I know that's what it's like and that's what I want to be part of. So, and that works based on your work experience you hired and based on your corporate culture I accept. So the outcome of all of this, next slide, is that this is the staff survey for 2020, and that's our organisation. This is the chart from the people who do the staff surveys. So they're all the other acute and community trusts that we were measured against, and our organisation showing for those questions about staff engagement, the highest score in the country for staff engagement. And just some of the detail about, like, what does that round get there? So this is the kind of difference in the scores. So recommendation as a place to work, you know, 79% against 67. Happy with the standards of care we provide to patients, 92 against 82 average. The organisation treats staff fairly, 93 against 83. Actions are taken if concerns are raised, 86 against 74. And is patient care your organisation's top priority? And again, 90% against 80%. So against the average nationally, you can see there's often, you know, really clear difference on some of those questions that we think are the most important, and they are the ones that we think are the most important. So they're the ones we focus on. And just to give a nod to Roy Lilly, because I know he likes people giving him a nod, when he is visiting the hospital a couple of years ago and saying it was the happiest hospital in the NHS, to which he's at the hot site, Western site there. I said, well, you just haven't visited our cold site, because that's even happier, because they haven't even got all those stresses of being the hot site, and it's an even happier place. So you saw those photographs I showed you at the beginning of what the estate was like. Well, that's what the estate's like now. Western Hospital, a hot site, St Helens Hospital, a cold site, and the bottom pictures of Newton Hospital, where we were in the intermediate care ward in there. And the gardens are just nice because we're only running the ward, not the whole building. I was running the whole building there to have nice flowers as well. So outstanding, it's just the most fantastic moment to get an outstanding rating, because I can't even tell you what it does for the staff. It's just the most brilliant thing. So there's some of our staff celebrating the day we were given the outstanding rating. So I said, didn't I, at the beginning with a wink, you know, that wouldn't it be great to be the best hospital in the NHS? And, you know, what metric to use it? I mean, winning the IHSCM Trust of the Year is probably the best proxy you can have to being able to say you were the best hospital in the NHS. So that was also, you know, a great night that we won the IHSCM award, and send in the party animal face. Next click. Yep, so great party. But so the best award of all, though, all of those things I've just said, best award was the one I got most recently, and this award was given to me at the Eid, our annual Eid celebration, which is a fabulous affair, this year. So it was in about September this year, and absolutely unexpectedly, with no warning whatsoever. And they've never given an award ever at the Eid celebration. It's not what they do. So they called me up and gave me this award. It's beautiful. It's more beautiful than it looks on this photograph. Beautiful award that says the leader of people is the servant of the people. Thank you, Anne, for being our true servant leader, from the Muslim Doctors Forum. And I kind of, I'd never thought of it in those terms before, so I kind of quickly looked up things about servant leaders, because it wasn't something it wasn't in my consciousness, I don't think. And so when I looked up servant leaders, these were the words that were associated. That's the next button. Yep. So it talked about people, you know, leaders who are empathetic and empowering and caring and respectful and trustworthy. And I thought, well, I'll certainly take that then. That sounds like a good set of adjectives to be associated with in terms of a leadership style. So I was very pleased to receive that award. And I was wanting to find a quote to kind of end this presentation on, and I quite like this next quote. If you click in, yeah, I quite like this quote in terms of you know, the message in terms of, you know, that kind of servant leadership. So this is a quote from John C. Maxwell, who's a management guru. You know, the most distinguished form of leadership is to deliver the benefit of the followers and not to enrich the ego of the leader, which I thought was quite a pertinent quote. But probably the best compliment that I've ever received in my entire managerial career in the NHS. Is obviously after I was given this award at the event, I obviously sent, an email saying, a very, humble thank you to the people who've given me the award, because I was so surprised it had happened. And so I sent an email, saying thank you very much. And this was the reply I got from the person who gave it to me. So this is from a man called Osama Munir, who's an associate specialist. He said in his reply to my email saying thank you, so there's no need to thank us. Nothing can convey how proud and happy we feel working under your leadership. I thought, well, that's just the best compliment you could ever have. And I'm very grateful to have received it. I'm very proud to lead such a wonderful team. Thank you. And John, thank you.
And if anybody just listening to that has just got to be thinking to themselves, goodness me, that's how you do it. That's how you do it. There's no, I think you can read all of the management books, you can read all of the leadership books, but it just boils down, from my perspective, to being compassionate, being empathetic, giving a damn about your people, and making sure that they know it. And as you say, I love the quote about it's not about massaging the ego, it's about serving the people whom you are privileged to lead. So look, that's how you do it, folks. If any of you are in any doubt, there's the blueprint. You've just seen it and heard it with your own eyes and ears. Would anybody like to ask Anne a question, I wonder? I've got to tell you this, and if you're looking at the chat now, Louise Marsh says, what a fantastic opening to this conference. Thank you, Anne, well done. There is hope while we adopt the principles you've served and managed by. That's lovely, isn't it? Thank you, Louise. What a lovely thing to say. Lots of other people saying fantastic, inspirational. Morgan says it's dusty in here, but she's feeling very inspired now. That's delightful. So come on, this is your big chance. You've got about 2 or 3 minutes. Would anybody like to ask Anne a question, please? I'm going to open it up. Do feel free to just pop your virtual hand up, and we'll go from there. Oh, here we go. John Matthias. And John asks, has anyone ever responded to your challenge about values and opted to work elsewhere?
Well, I'll give you two kind of examples of that. So sometimes when I'd have that conversation with the consultants, and then nobody's ever said, no, I don't want to adopt those values, so I don't want the job. But you do get people who say, oh yeah, sure, and then they don't, Yeah. So what I do then is I get them in afterwards and say, do you remember that conversation we had before you were appointed about, what values and behaviours are expected? Well, I'm not hearing that you're following them. And so, it's not too late to go and find somewhere else to work, because there's loads of jobs going out there these days. So do feel free, you don't have to adopt our values and behaviours if you don't want to work here, but if you do, you do. Now, it's not Disneyland, so, you can have that conversation several times. Nobody's ever then left there. But, there's times when I wish they would, because it's like, I don't want that. I don't want people behaving like that. So, but the other thing is, when I very first came to the organisation, there was a bit, one of the challenges you have to overcome. Well, the middle management thing, when you've got the middle management doing something different, so you're, as the leader, saying, this is all the way we're going to behave and everything. If the middle management aren't doing it, you're in trouble, because that's where the message stops. So there were some, not loads, some people who, didn't want to adopt that style of behaviour, who did want that kind of ego-driven thing or whatever, or it just looked, it wasn't for them. I've never been a person who's come in and cleared places out. I've never ever done that. But people kind of left of their own volition, and so those who didn't want to kind of engage, went off and did something else, and that was fine. So what you ended up with was the kind of cohort of middle managers, particularly, who did believe, and who did stick with the message, because obviously the message can get distorted otherwise. And that thing about the words and deeds being congruent, my words and deeds can be congruent, but everybody else's have to be as well. It's not just, it doesn't stop there. It has to be right throughout the whole management hierarchy. So yeah, that at the start, that was a bit of an issue.
Perfect answer. Thank you, Anne. And Linda Robinson has got a hand up. Linda, would you like to unmute and ask a question?
Morning, Anne. Hi, John. Thanks, Anne. I'm really, really interested in what you're saying, and really appreciative of the the nod to some of that servant leadership, which I think is fantastic. It's probably following on from the question you just answered, but obviously, worked in the NHS a long time, and it's never always sweet. So when it does hit the rails, and it does really get sour, and things perhaps don't go as you want them to, what should go to is in terms of your leadership actions then to sort of bring that organisation round or do something differently?
Well, it's just sticking to your values and sticking to your objectives, always doing the right thing by the patients, no matter what the consequence. And when the organisation trusts that you'll always do the right thing by the patients, no matter what the consequences, and believe me, there have been times when that has been a really tough thing, in previous regimes, can I say, whereby there's been quite a harsh culture, and sometimes doing the right things by the patients hasn't been what's been the popular decision from the people necessarily up the chain above me. But I've no matter what's happened coming being directed downwards, I've made sure that when I direct things downwards, it's directed in the right way, and that is always about sticking to what we've always believed in and always promised to do and never changed, no matter what. And just but then you become the kind of shock absorber between what's expected from above and what you believe is right for your organisation and for your staff and for your patients, so it's just stick with it no matter what.
Brilliant. And thank you, Linda. Thank you for being brave and unmuting and putting your camera on. That's fantastic. And just very quick, we've just all of a sudden, needless to say, as we're running out of time, all the questions now start to pile in. But Bernard's got a good one. He says, how did you address the challenge of resistance to change to your vision within the trust? I suppose the first thing was there any resistance? And then the second thing is, what did you do to address that?
Yeah. Well, one of my stories used to tell, I drew a picture of it right at the start. Was like I was like the captain on the ship, and all the crew were partying, and I wasn't invited to the party. When I used to say, where do we sail into? They'd say, we don't sail anywhere, we just rearrange the deck chairs. And you know what? We haven't got enough staff to rearrange the deck chairs, so we need some more. And I'd be like, oh, do you think we might start up the engine of this ship? And they'd be like, we don't start the engine. Nobody even knows how to start the engine. And so I used to draw this analogy when I was talking to the other execs about this is what we're up against. At first I didn't even have any execs, so it's nice to have some execs eventually. And obviously I recruited them very carefully. But yeah, you start with getting a team around you that all buy into it, and then you deal with the next level down. But you keep selling this vision to the organisation. That's what we're going to deliver. And it's hard when you're not delivering it, because at first it's quite hard to wiring up the levers, making things happen, starting the engine ship and all that stuff, and starting to move in that right direction. You just have to keep going at it, and as I say, particularly tackling that the message is getting right down the organisation. So a lot of it means you've got to kind of go out and be very visible and be saying and doing these things visibly, because you can't trust that it will just cascade down.
That's perfect. I love that answer. And Sasha's got a question about change, but I'll kind of just squidge it down, if I may. When you started the process, Anne, was there anything that you could point to real quick that you thought, aha, this is working? Was there a really quick win that you would say that was the kind of catalyst when a lot of other people suddenly start to think, oh, this might work,
Yeah, I think that the kind of demoralisation of feeling like it's like we were a failure. The population hated us, the hospitals get slagged off all the time. When you started to get, we did a bit of like making sure we got some good press coverage for anything good we did. We put a lot of effort in to that, kind of change in the perception of the organisation. And obviously, most people would like that. People working in an organisation don't like that. Their organisation is kind of held up in such bad regard by everyone around it. So beginning to that thing about this is what it can be like when we deliver what the population wants from us and we engage with them. So yeah, I think that whole thing about the way we managed the comms of it all was quite significant. Trying to get the messages across both internally but also externally as well. And I did a lot of things, meeting with the local MPs and the councillors and and all that kind of stuff to outline to them, we need your back in here. Not, give us a break. Start being positive, see if it works. And of course now we have this fabulous relationship with the MPs and the councillors and all that kind of thing. So it's trying to just get more, give them something to, get a glimpse of what it can be like to be in that situation, not the situation we were in. And I do think that kind of the comms, what you do with your comms department is really important, both internally and externally.
Okay, well, look, we're unfortunately, I could speak to you for the rest of the morning quite happily. I'm sure most of the people on the call could as well, but we are out of time, I'm afraid. Can we all just say a huge thank you to the fabulous, the one, the only Marr, OBE, Chief Executive of St Helens and Knowsley NHS Trust.